complexities of healthcare delivery at the primary level as a result of expanding population and numerous factors necessitated the development of robust measures to raise the bar of service delivery in our dear country, Nigeria. From upgrading public or let's say primary healthcare facilities in the 774 local councils, the provision of technologically advanced diagnostic tools, strengthening immunization, provision of essential drugs, and most especially, professionally trained workforce are all part of successes and work in progress to reposition rural healthcare in Nigeria. These and many more form the mandate by the National Primary Healthcare Development Agency as it strives to build the trusts of rural dwellers in PHCs. This is Reshaping Democracy, and I'm Ayodeji Makinde. Well, it may interest you to note that the political will and determination of the federal government to revitalize health care is encouraging, particularly at the state and local councils who are working in unison to get the primary level and foundation of health services on a higher pedestal. The Executive Director of the National Primary Healthcare Development Agency, Dr. Muyi Aino, is our man of the moment on Reshaping Democracy as a response to citizens' questions on the multifaceted approach to turn around rural health services.
Executive Director, sir, can you elaborate on the plan to upgrade primary health care facilities and ensure there is at least one fully functional facility per ward nationwide? And what is the timeline for completion?
President Tinubu's government has prioritized healthcare sector, broadly speaking, and specific focus has been on primary healthcare. One of the gaps that we all identified when we came in is that because of a history of chronic under-resourcing of the primary healthcare system at all levels, a lot of the primary health centers were in unacceptable shapes. Some of them were completely abandoned. Many that were even being used could not meet the bar of full functionality. Now, the president, in keeping with his words, prioritized the revitalization of primary health centers and set a target of having 17,000 functional facilities, 17,600 across the country in a 4-year time frame. So what that means is that it includes at least one level 2 facility per ward. And then beyond that, we are also working to expand the numbers in a way that is not necessarily a 2 per ward equal, but really filling gaps and in a way to ensure equitable access to primary health services. So when we did the assessment, less than 1 in 5 of even the top tier, the 8,400 primary health centers that were already starting to receive funding directly from the federal government in form of basic healthcare provision fund, where they had the infrastructure, the buildings, the health workforce, had reliable power and were able to basically set up to provide services for 24 hours. So we got to work, and I can tell you that in the last year or so that this intervention has started, thanks to the magnanimity and prioritization of the president and the leadership of the coordinating minister for health, Mohammed Pate, as well as the Minister of State for Health, Dr. Ishiak Salako. What has happened is we have worked with states and stakeholders to now revitalize 1,295 as at the last count. So almost 1,300 primary health centers additional, have now been revitalized to what is called level 2.
How are you going to make sure that the structures that are provided in each political wards are equipped with modern day health care examination equipment?
The role of technology in service delivery is important now more than ever. And there are many reasons why. One is that for quality of care, you need access to information in an accessible and in a way that you can analyze and use for decision very quickly. At the same time, while Nigeria is still, unfortunately, suffering our population from the burden of infectious diseases, many of which can be prevented through things like hygiene and vaccines and things, we're also having an evolution in our disease epidemiology, that we're having more and more people with what is called non-communicable diseases, and many of this require technology to be able to screen and identify them very quickly. So simple diagnostic tools like rapid diagnostic tools, and also to treat them, at least at the basic level that we're supposed to do at the primary healthcare level. So what we have done is, in accordance with our minimum service package, we have identified the basic set of tools, both equipment and commodities. So equipment like laboratory diagnostic tests, the equipment that you need for that. Commodities like rapid kits, tools to collect samples, even if you cannot do them in-house, that you can take them to other places. And we have developed what's that package that each PHC needs. And I mentioned earlier that we have procured and in fact now distributing to the first 500 PHCs, this complement of equipment.
My question is, what strategies is the National Primary Health Care Development Agency employing to strengthen immunization program against preventable childhood killer diseases?
Thank you. I think the immunization program is one of the very core interventions that the National Primary Healthcare Development Agency anchors in Nigeria. And we think about immunization in two segments. There's what is called the routine immunization, which is what everybody gets. So when you're born, whether it goes across the different ages in life, when you're a child, there's certain routine immunizations that you get from birth to the age of 15 months. When you're a teenager, there's what you get, the human papilloma virus. When you're a pregnant woman, there are vaccines that you get. And when you're an adult, in fact, there are vaccines that you get periodically, to boost your immunity. Then there is what we do for vaccinations program that relates to outbreak response. When there is an outbreak of diphtheria, when there's an outbreak of measles, when there's an outbreak of even cholera, then you deploy vaccines in the form of a campaign to respond to those. The president has really led the introduction, addition to our routine vaccine complement, very important tools that are critical to saving the lives of Nigerians and preventing avoidable illnesses and deaths. One of them is the human papilloma virus vaccine, which was introduced in 2023. The vaccine financing bit, the government has incrementally increased the amount of money that is released, budgeted and released for the purchase of vaccines, because with growing population, with more vaccines in the program is more expensive.
Is it with only 22% of facilities nationwide having a required healthcare workforce? What initiative will the National Primary Healthcare Development Agency implement to address this challenging shortage of skilled manpower?
Fantastic question. I think the issue of skilled manpower goes beyond the agency. I think this is one of the many areas that the Coordinating Minister for Health and Social Welfare has really taken head on. In the issue of manpower, because we have shortages and we have a lot of losses due to out-migration, we're doing a number of things as a sector. One is to increase production. The other is to train and retrain those that are existing and then improve retention, especially in the rural areas. In terms of increasing production, what has been done is many of the schools of medicine, nursing, midwifery, even health technology have had their production capacities, meaning the number of people they can train, doubled, by President Tinubu's government. And the investments in the institutions to try to make sure they have, because it's not just about doubling the number, you also need to have the facilities to train double the number, are being provided, for these institutions, even as we speak. So that's one area there. And the president really weighed in by issuing the necessary, political and policy framework around it, including executive orders, as necessary for manpower to enable the retention of manpower within the health sector. In addition to that, for those that are in existence, the president really took on the challenge to say, let's make sure they are equipped with the skills that they need. So let us retrain them, and he set for us a target to retrain 120,000 frontline health workers, those that are already in the facilities working, just to make sure they have the skills to work. As at last I checked, over 69,000 of them have now been retrained. The goal is to train 120,000 before 2027. The African Union saw this leadership and saw what the president is doing, and they actually appointed President Tinubu as the AU ambassador for community health workers, for Africa, because of this intervention, which is an honor that I think we need to also recognize at home, that if the global community, if the continent is seeing what our president is doing.
In what way is the National Primary Healthcare Development Agency applying modern technology to strengthen the study and application of knowledge by healthcare professionals in rural areas of Nigeria?
Fantastic. The president asked us to retrain all of the frontline health workers, 120,000 of them that are currently working in the health facilities. And we are well, in the process of doing that. 69,000 plus have been trained so far. We are adding to that number every day, and especially as the states and local governments are recruiting more, we are also training them. We have found that pulling them together in central locations for classroom trainings is effective and creates a lot of visibility, but is not as efficient, because when you remove health workers from their facilities, they're not available to do work. Also, the risks and costs of travel is not the most efficient. So while this is necessary to restart this mechanism, we are now transitioning that to a digital learning platform, which we're working with 2 of our local universities as partners. And what we have done is to take all of the skills that these health workers need in the facilities and distill them, working with trainers, certified trainers, and people who know the science of adult learning more than we do, to bite-sized videos. So how do you measure the blood pressure of a person? How do you examine a pregnant woman? With demonstrations, so that a health worker can, at their own free time, in the evening or between patients or in the weekend, they can log on their device, which, by the way, we are now providing devices for most of the facilities. And the idea is that they can log on and they can watch this, and it is tracked over time. So if you watch it, you have to take a test to check whether you have understood the content. If not, you have to repeat it. And each health worker will be required to get a minimum amount of proficiency every year.
What incentive will NPHCDA provide to encourage healthcare professionals work in the rural areas? And how will the agency ensure the retention of these professionals?
Ultimately, I think it's important to establish that hiring and retaining health workers at the primary health center level is really the responsibility of states and local governments. The federal government and the agency does things to enable them to do this. So we give guidance, we mobilize some resources to support them, we provide guidelines, we support them in many ways, some sort of oversight. However, that responsibility sits with states and local governments. There are a number of things in place that are aimed at really improving retention, because like you said, some of our localities are quite harsh to stay, especially if you have a young family who needs to go to school. Sometimes spouses of health workers, many of whom are women, many of the frontline health workers are women. Sometimes their spouses are living in a different town or city or the local government or state headquarters versus the rural community where their services are most urgently needed. And so we're doing a number of things. One is, as part of the definition of a fully functional facility now, and that applies to the newly revitalized facilities that we are doing and that the states are doing, we're including accommodation on site so that the costs and the risks of back and forth travel every day is reduced, and so that the staff can work within themselves, shift arrangements that let you go, stay for a few days, come back while other staff are on ground, so that there's accommodation, they can sleep there. Also helps them to work 24 hours. We also now have power, solar power in all of this, so that they can do other things, they can develop themselves, they can at least have, a more decent living experience and working experience while they are there. In addition, as part of the revised Basic Healthcare Provision Fund guidelines, BHCPF, we are increasing the amount of money that will go to health facilities. High volume facilities across the country that are supported by BHCPF will now get up to 800,000 naira, I believe, per quarter, while low volume facilities will get 600,000.
How would the National Primary Healthcare and Development Agency ensure consistent supply of essential drugs and vaccines to primary healthcare facilities? And what measures can be taken to ensure and prevent stockouts?
Very important to establish from the beginning that the responsibility for ensuring commodities are available in primary health centers sits with states and local governments. So in every state, the State Primary Healthcare Development Agency or board works with the drug management agencies, to make sure that the health facilities can have a drug revolving fund where they can procure, sell in some way, and reprocure these commodities. However, the NPHCDA, as part of the broader federal level health sector, does interventions where there are gaps. So in fact, in the last couple of months, we have had commodities targeting maternal and newborn health, commodities targeting reproductive health, family planning, and other commodities, basically an essential commodities, by the way, that we bought, which is the essentials, the antihypertensive, antidiabetics, antibiotics, and things like that, that the federal government has procured, again, through a specific intervention of President Tinubu, and every single local government in this country is being impacted by that. That's a seed stock. That's not going to be enough to serve everybody there perpetually. But it's also not a sustainable arrangement for the NPHCDA to be the one buying and pushing. So it's to rejuvenate this, to reactivate this. But as an incentive, there's a big program that has just started up called Project Hope, which is it is anchored, it's an intervention with one of our partners by the federal government that will give resources to states, but in the form of what is called disbursement-linked indicators. What that means is that states will achieve certain performance outcomes and then they will get money.
Can you discuss National Primary Health Care and Development Agency collaboration with state agencies, other health institutions, and community stakeholders to promote community ownership of primary health care facilities and services for sustainable initiatives?
What I would consider some real good fortune that we have had, in the last couple of years that we have been here, is the political will at the highest level, at the president and the presidency, at the Federal Ministry of Health, at the health agencies at the federal level. And frankly as well, we are getting buy-in and support and interest. States are stepping up. States are committing their resources to PHC revitalization. States are recruiting health workers. In fact, I can tell you that 2 states, Kaduna and Yobe, have completed the recruitment of health workers as part of a collaboration we're doing. There are 3 additional ones that have actually also completed the process but have not issued letters. And there are at least 5 to 7 others that are in different stages in the process that I am aware of. So states are also stepping up. Local governments have showed interest. We have engaged very closely, and in fact, we came up with some sort of intervention where federal, state, and local government stakeholders, local government chairmen as well, came together to agree how we want to ensure quality primary health care for Nigerians. And at the end of that workshop, there was a communique that was signed that is guiding the framework that we're taking to go forward, defining a role for each level and what we will do. So from a government perspective, there's a lot of collaboration there. We have quarterly engagements, you know, between NPHCDA, state commissioners, state executive secretaries, chief executives of primary healthcare agencies. We also have, now when the ALGON, the local government chairmen, have their quarterly meetings, they do invite us and we talk to them as well. We engage, interact with them, hear from them and feed them back. And we're co-creating and co-implementing all of this together. Don't forget that at this time we're operating what is called a sector-wide approach. So the Health Sector Renewal Investment Initiative is being implemented through a sector-wide approach that takes all of the tiers of government, or the private sector and the non-governmental development partners as well, you know, as one. Now, there's also a role for the communities in all of this, because ultimately, I can't sit here and know what is going on in every community. The president has done his own. He has given us money to do work. He has given us a charge to do work. The minister, we were trying to do our bit by making sure that we put in the inputs and have the processes in place. But there is something around accountability as well as demand that sits heavily on the communities. If we send equipment to a facility, okay, I cannot go around 8,000 facilities to make sure that all the equipment are still there. We can have mechanisms to check, but the community can take custody of it and watch it so that a health worker cannot just take it and take it to their house or take it to divert it to other uses.
Surely, National Primary Healthcare Development Agency has so far vaccinated 15 million young girls against human papillomavirus that causes cervical cancer, and is providing digital tech training for 120,000 professionals in integrated PHC services, in addition to renewable energy, data services, accommodation. Come on, the list is endless. This is happening in rural areas as continuous funding, total upgrade, and engagement by the national agency with stakeholders at all levels is a positive indicator that PHCs in Nigeria are moving to the next level. That'll be all tonight. I'm Ayodeji. Making it over back again same time next week. Bye-bye.